Good morning, everyone. I want to start with a scene I've watched play out in my exam room more times than I can count. A man, let's call him Frank, 68 years old, retired, active, proud of the fact that he's never been sick a day in his life, sits across from me and says quietly, almost embarrassed, "Doc, I get up 4 times a night now. I thought it was just age. My grandson showed me a video that said some nut cures it. Is that true?" I hear some version of that question every single week. My name is Doctor, your name, and I've spent my career caring for older adults, helping them stay strong, independent, and confident in their own bodies. Today, I want to talk about something that affects roughly half of men in their 60s and up to 90% of men in their 80s, yet very few people talk about it openly at the dinner table: the prostate and the condition called BPH, Benign Prostatic Hyperplasia. I also want to address, directly and honestly, the flood of videos and articles promising that one powerful nut or one secret food will shrink your prostate overnight. I understand why those videos are tempting, but my job today isn't to sell you a miracle. It's to give you the truth, the real science, the real options, and the real hope, which is actually better news than any miracle food could ever offer. 2. Introduction to the topic. So, what exactly are we talking about? The prostate is a small gland, about the size of a walnut, that sits just below the bladder in men. Its main job earlier in life is to produce part of the fluid that carries sperm. You don't think about it much when you're young, but as men age, this little gland tends to grow. That growth is called benign prostatic hyperplasia, or BPH for short. Let's break down that term, because medical language can feel like its own language. Benign simply means not cancer. This is important, and I want to say it clearly at the start. BPH is not prostate cancer, and having BPH does not mean you have or will get cancer. Prostatic just means related to the prostate. Hyperplasia means an increase in the number of cells, in this case, the gland growing larger than it used to be. So BPH is, quite literally, a natural, age-related enlargement of the prostate gland. It's not an infection. It's not a tumor in the dangerous sense. It's closer to something like gray hair or reading glasses, a very common part of aging, though one that can genuinely affect quality of life. Why should you care? Because when the prostate enlarges, it can squeeze the urethra, the tube urine flows through, and that can affect sleep, bladder control, energy, confidence, travel, intimacy, and independence. This isn't a vanity issue. It's a quality of life issue, and for some men, if left unaddressed, it can lead to real medical complications. 3. Medical explanation. The science behind it. Let me give you an analogy I use often with my patients. Picture a garden hose with a small ring around it near one end. If that ring slowly tightens over years, the water can still get through, but it comes out slower, with less force, and sometimes it dribbles even after you've turned off the tap. That ring is a lot like what happens with BPH. The prostate wraps around the urethra like a donut around a straw. As the donut grows thicker, it narrows that straw, making it harder for urine to pass freely. What causes this growth? The honest, evidence-based answer is, we don't have one single cause, but we know several major contributors. Age is the single strongest factor. As men get older, the balance of hormones in the body shifts, particularly testosterone and a related hormone called dihydrotestosterone, DHT, along with estrogen levels, which also rise slightly with age. This hormonal shift is thought to stimulate prostate cell growth over time. Genetics play a role. If your father or brother had BPH, your risk is somewhat higher. Other factors researchers have studied include obesity, lack of physical activity, and metabolic conditions like diabetes and high blood pressure, all of which appear linked to a higher likelihood of BPH or more severe symptoms. It's important to understand BPH is not caused by anything you did wrong. It is not caused by a particular food you ate too much of, and despite what some online content suggests, it is also not cured by a single food you start eating now. Biology is rarely that simple, and I'd rather tell you that honestly than sell you a fantasy. 4. Symptoms and warning signs. So how does BPH actually show up in daily life? The symptoms usually fall into two categories: storage symptoms and voiding symptoms. Storage symptoms: problems with how the bladder holds urine, needing to urinate more often than before, especially at night. This is called nocturia, and it's often the very first thing men notice. A sudden, strong urge to urinate that's hard to delay. Waking up 2, 3, 4 times a night. Voiding symptoms: problems with the actual flow. A weak or slow urine stream. Straining to start stopping and starting during urination. A feeling that the bladder never fully empties. Dribbling after finishing. Most men notice these symptoms creep in slowly over years, which is exactly why so many just accept them as normal aging, rather than mentioning them to a doctor. Now, here are the warning signs that should never be ignored, no matter how minor they seem. Blood in the urine. Inability to urinate at all. This is a medical emergency. Fever, chills, or pain with urination. This can suggest infection. Pain in the lower back, hips, or pelvis. Unexplained weight loss alongside urinary symptoms. If any of those appear, please don't wait for a natural remedy to work. See a doctor promptly. These symptoms need proper evaluation because while BPH is the most common cause of urinary changes in older men, it is not the only possible cause, and ruling out other conditions matters. 5. Diagnosis and medical evaluation. Here's the good news. Diagnosing BPH is usually straightforward, and it doesn't require anything frightening. A typical evaluation includes a conversation. I ask about your symptoms, how long they've been going on, and how much they bother you. We often use a simple questionnaire called the IPSS, International Prostate Symptom Score. Just a set of questions rating how often you experience each symptom. A physical exam, including a digital rectal exam, DRE. I know this exam has a reputation for being uncomfortable to talk about, let alone experience, but it takes under a minute and gives me valuable information about the size, shape, and texture of the prostate. A urine test to check for infection or blood. A blood test called PSA, prostate-specific antigen, which can help evaluate prostate health, though it's interpreted carefully alongside other findings. A high PSA doesn't automatically mean cancer, and a normal PSA doesn't rule out BPH. In some cases, an ultrasound or a urine flow test to measure how quickly and completely the bladder empties. None of this requires guesswork or fear. It requires simply making the appointment. 6. Treatment and management. This is where I really want you to feel hopeful, because we have excellent, well-studied options, far more reliable than any single miracle food. For mild symptoms, often we start with watchful waiting combined with lifestyle adjustments, things like reducing evening fluid intake, cutting back on caffeine and alcohol, and timing medications properly. Medications, which are typically the first treatment step for moderate symptoms. Alpha blockers, such as tamsulosin, relax the muscles around the prostate and bladder neck, making it easier to urinate, often within days. 5-alpha reductase inhibitors, such as finasteride or dutasteride, work more slowly over months, actually shrinking the prostate tissue by blocking the hormone that drives its growth. Sometimes these are combined for men with larger prostates or more significant symptoms. Minimally invasive procedures for men who don't respond well enough to medication or prefer not to take daily pills, including options like UroLift, a device that lifts and holds enlarged prostate tissue out of the way. Laser therapies that reduce prostate tissue, water vapor therapy, resume. Surgery, such as TURP, transurethral resection of the prostate, remains a very effective, well-established option for more significant cases, and modern techniques have made recovery much smoother than decades ago. I want to emphasize something important. There is no one-size-fits-all treatment. The right approach depends on your prostate size, your symptoms, your other health conditions, and your personal preferences. This is a conversation to have with your own doctor, not a decision to make from a video on your phone. 7. Prevention and healthy habits. While we can't fully prevent prostate aging any more than we can prevent gray hair, there are habits genuinely supported by research that help manage symptoms and support overall prostate and urinary health. Stay physically active. Regular exercise is associated with lower BPH symptom severity in multiple studies. Maintain a healthy weight. Excess weight, particularly around the abdomen, is linked to worse urinary symptoms. Watch your fluid timing, not just your total intake. Reducing fluids, especially caffeine and alcohol, in the few hours before bed can meaningfully cut down nighttime trips to the bathroom. Eat a diet rich in vegetables, fruits, and healthy fats, similar to a Mediterranean-style diet, which several studies associate with lower rates of urinary symptoms. Include foods like pumpkin seeds, nuts, and fish as part of an overall healthy diet. Pumpkin seeds contain zinc and plant compounds that some smaller studies suggest may offer modest symptom relief for some men. But I want to be precise with you. This evidence is limited and mixed. The effect, if any, is modest. And none of it amounts to shrinking the prostate the way medication or procedures can. Think of it as a small supporting player, not a leading actor. Don't hold your urine for long periods out of habit. This can strain the bladder over time. Get regular checkups, especially after age 50 or 45 if you have a family history, so changes are caught early. 8. Common myths and misconceptions. Let's clear a few things up, because misinformation in this area is genuinely widespread, and it can cause real harm, either by giving false reassurance or by causing needless fear. Myth number 1. There's one powerful nut or superfood that shrinks the prostate. This is the claim behind a lot of viral content, and I want to be direct with you. No single food has been shown in solid clinical research to shrink an enlarged prostate. Some nutrients, zinc, certain plant sterols found in pumpkin seeds, lycopene in tomatoes, have been studied for a possible modest effect on symptoms, but shrinks your prostate is a dramatic overstatement of thin evidence. Be especially cautious of any video or article that frames medical information as a secret doctors won't tell you. Ethical doctors want you informed, not withholding information for drama. Myth number 2. BPH means I have prostate cancer, or it will turn into cancer. False. BPH and prostate cancer are different conditions with different mechanisms. Having one does not mean you have or will develop the other, though both become more common with age, which is part of why regular screening matters. Myth number 3. If I just live with the symptoms, nothing bad will happen. Not quite. While BPH itself isn't life-threatening, ignoring worsening symptoms can, in some cases, lead to urinary retention, bladder damage, kidney problems, or infections. It's worth addressing, not suffering through silently. Myth number 4. Treatment always means surgery. Not true at all. Most men are managed successfully with lifestyle changes and or medication long before surgery is ever discussed. Myth number 5. This is embarrassing, and I shouldn't talk about it. I understand why it feels that way, but I promise you, your doctor has had this exact conversation hundreds of times. There is nothing to be ashamed of in your body, simply aging. 9. doctor's advice. If there's one thing I want you to carry home with you today, it's this. You deserve accurate information, not sensationalism. I know it's tempting to believe that a simple, natural one-step fix exists. It would be wonderful if it did. But real medicine, the kind that has actually helped millions of men sleep through the night again, walk into a movie theater without anxiety, and feel like themselves again, comes from a combination of honest conversations, proper evaluation, and personalized care. Please don't let embarrassment keep you silent, and please don't let a viral video replace a visit to your doctor. You are not being dramatic by asking questions. You are being responsible for your own health, and that is something to be proud of, not embarrassed by. Frank, the patient I mentioned at the start, eventually did come in for that conversation. We talked through his symptoms, ran a few simple tests, started with a medication, and adjusted his evening routine. Within a few weeks, he was sleeping through most nights again. He told me, half joking, I wish I'd asked sooner instead of watching 4 different videos about magic seeds first. That's really the heart of what I want to leave you with today. Aging is not something to fear, and an enlarged prostate is not a life sentence. It's a common, manageable, well-understood condition. And the path forward isn't a secret hidden in a nut or a seed. It's the same path it's always been. Open conversation, proper evaluation, and care tailored to you. Take care of your body. Ask the questions that feel awkward. Make the appointment you've been putting off. That is how you truly protect your health, not by chasing a miracle, but by trusting the real, steady, well-earned progress of medicine and the people who practice it with you in mind. Thank you.